I'm Gene Liu, and I'm an otolaryngologist, head and neck surgeon, or ear, nose, and throat doctor here in Los Angeles, and I wanted today to give you a little overview about ear tubes. Now, most of the time when we talk about ear tubes, we're in the context of little kids. The reason for that is kids have a lot more issues unclogging and unplugging that little pocket of air behind the eardrum called the middle ear. And they get more problems in that area for a couple of different reasons. Number one is that their immune system is more immature. So every little virus or bacteria that comes along, they react a little bit more strongly. They're more likely to get a stuffy blocked nose. And if everything in the middle of your head is clogged up, it's not unusual for that to back up to the ear. Additionally, the eustachian tube, the little tunnel that connects from the ear to the back of the nose that allow you to pop and equalize your ear when you go up and down in an airplane, or the thing that you blow air into when you pinch your nose and do this, well, that eustachian tube in little kids is much shorter and almost horizontal, so everything goes into the ear a lot easier and has a hard time coming out. As you get older and older and you grow, the orientation of it goes more vertical and it gets longer. So easier for things to drain out, harder for things to get up and in. And as the orientation in your head changes, it also allows the muscles in the back of your throat and jaw, every time you yawn, you swallow, you wiggle your jaw, to more efficiently open the eustachian tube and unclog the ear. That's something that also gets better and better with age. Lastly, little kids don't have the body awareness or understanding to know that when they get that feeling of pressure in the ear, that they need to do certain things to get it to unclog. So the older you get, all of those things get better and better. You tend to have less and less issues with the ear, which is why you almost never hear about older kids or adults getting ear tubes. When somebody has trouble unclogging the ears, that may show up as ear infections again and again and again. And to clarify, we're talking about middle ear infections or acute otitis media. We're not talking about swimmer's ear or outer ear infections. If you get enough episodes of middle ear infections, then it might make sense to break that cycle with ear tubes. We certainly don't want anybody on antibiotics over and over again. On occasion, all you need is one or two severe or prolonged bouts of otitis or chronic otitis for it to be an issue. There are also times where with severe infections you can have complications like rupturing the eardrum over and over, or more importantly, damage to the inner ear or facial nerve. Those types of things can also lead to putting in tubes sooner rather than later. Even if you never get an infection, if your ear is clogged with enough pressure or mucus or fluid, it muffles the hearing. So even if it never gets red and angry, even if you never get an infection, if it muffles and blocks your hearing month after month after month, that's going to be an issue. So sometimes we'll put in ear tubes to unclog the ear to better facilitate hearing and speech and language development. There are more exotic reasons to put in ear tubes, like changes in structural integrity of the eardrum, but we're not going to get too deep in the weeds with that right now. The actual procedure to put in ear tubes is pretty easy. In a cooperative adult, it can be done in the office. You sit in the chair, we put in a little bit of numbing medicine into the ear, a little poke, a little piece of plastic. It generally takes about 30 seconds or so on each side. Pretty easy. In freaked out kids though, they might let you poke one ear, but you're never going to get too far beyond that. So for most small children or even slightly older children, you're more likely need to go to sleep under anesthesia to have it done. If it's the only procedure you're having done, it's generally just a little mask or an inhalational anesthetic with gas, and we don't put in a breathing tube or an IV. Once you have ear tubes in place, altitude changes going up and down in an airplane, driving up and down over the hill, you're not going to feel any pressure build up because it's wide open. Additionally, you almost never get ear infections with ear tubes in place. If you do, it comes from one of two ways. So if you get a stuffy, snotty nose and it floods up, where it used to get trapped behind the eardrum, it will now drain out through the tube. If you get snotty goo draining out of the ear, then you use ear drops. We don't have to do antibiotics by mouth or by shot. In general, we do not recommend any water precautions with people with ear tubes, meaning you can take a bath, you can take a shower, you can jump into the ocean, jump into a pool without any worry. Once in a rare while though, we will have somebody where when water gets in, instead of stopping at the eardrum, it goes through the tube and can cause a little discomfort or drainage. If it happens once, we treat it with drops. If it happens again and again and again, then you either avoid the water or wear earplugs to avoid the problem. In general, the tubes remain in place for about 1.5 years. The eardrums will push out the tube and close the hole almost always on its own. It doesn't require a separate procedure. There are times where the tube comes out a little bit early, but even a few months usually buys you enough time to outgrow the problem. On the flip side, if the tubes are still in somewhere between 2 and 3 years after they were put in, we sometimes will go to sleep to take the tube out to avoid a permanent hole in the eardrum. A hole in the eardrum is a risk for having tubes, though it is highly unlikely. If you happen to have an eardrum that doesn't heal after the tube comes out, it sometimes does require a separate procedure to patch that hole, but it is normally very straightforward and outpatient. Adenoids are a little clump of lymphatic tissue or part of the body's immune system behind the nose. It's a little bit like tonsils in the back of the throat. The adenoids sit right where the eustachian tube connects to the back of the nose, and if they are enlarged or inflamed can certainly contribute to why somebody may have ear issues. In children over 4 who continue to have ear problems, it is highly likely that the adenoids are part of the issue, and a lot of times we will evaluate the adenoids at the time of ear tube surgery. In children who are getting their second set of ear tubes, we start to look for other reasons why the ear issues may be continuing to happen. So it is highly likely that in these children, adenoids are part of the issue and may be taken out during that second set of ear tubes. Another time to consider taking out adenoids is simply in a child who has chronic or recurrent nasal congestion, runny nose, they can't ever breathe that well, they get a lot of sinus infection or head colds. We absolutely will see this sometimes in the setting of somebody who also has a bunch of ear infections. So adenoids are not something that we always take out during ear tube surgery, but depending on what's going on with the child and what some of the other symptoms are, we will certainly consider it. There are adults on the planet who have trouble with eustachian tube dysfunction and trouble popping and clearing their ears. In general, if the issues don't resolve with medical therapy, nose sprays, decongestants, and other more conservative measures, we will sometimes put in ear tubes even in adults just to keep the ear unclogged. I hope that this was a good overview about ear tubes. Please, if you have any additional questions, leave it in the comments below, and I'll make some subsequent follow-up videos to give you more information.